Na 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 na. This melody, kind of borrowed from Chainsmokers and Coldplay song, is not sung in vain. The good news is that I am completing almost 5 years of podcasting with 200 plus episodes and 14k plus downloads all around the globe. Isn't this simply wonderful? Welcome all to his Pharmacology Difficult podcast. I'm your host Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. Well, continuing our talk about migraine, first and foremost, we will discuss the clinical applications of triptans. The first one is surely to count, that is in the acute treatment of migraine attack. If the attack is not accompanied with nausea and vomiting, the most convenient are the oral formulations of triptans, else we need to go for parenteral, that is injectable, and we can also go for nasal spray formulations. One thing you should always keep in mind and one thing to note is that the combinations of triptans with ergot derivatives is strictly contraindicated, prohibited, not allowed. The most commonly experienced adverse drug reactions of triptans are bitter taste, paresthesias, fatigue, flushing, pain in neck, jaw, chest, dizziness, nausea, and sweating. In some severe cases, they can also lead to serotonin syndrome, especially when they are used in combinations with capital SSRIs, that is selective serotonin reuptake inhibitor drugs, with capital SNRIs, that is selective noradrenaline reuptake inhibitor drugs, capital TCAs, that is tricyclic antidepressants, and capital MAO inhibitors, that is monoamine oxidase inhibitors. So remember these combinations. If in severe cases, these combinations can lead to serotonin syndrome. Sometimes what happens, adverse cardiac events, they can also occur. And these may be something like coronary artery vasospasm, transient ischemia, arterial and ventricular arrhythmias, myocardial infarction, and these occurs mainly in patients with cardiovascular insufficiency. So, if a patient is already suffering from cardiovascular insufficiency or any such kind of problems like stroke, etc., then triptans are absolutely contraindicated in such kind of patients. Triptans can also cause sudden rise in blood pressure. They are also contraindicated in hypertensive patients. It's a nice time to talk about a novel drug, lasmiditan. It's a non-triptan 5-HT1F selective agonist, and it is approved as it shows less cardiac adverse effects. Naratriptan, on the other hand, is contraindicated in cardiac patients. Rizatriptan is also used with great caution. Elatriptan is contraindicated in hepatic diseases, and status of triptans in pregnant women and lactating mothers is also under research and yet to be confirmed. FDA approves triptans in pregnancy only when it is convinced that the risk to the fetus is absolutely zero. Well, in such concerns, it is found that sumatriptan is the safest of all. Now let's turn our pages towards ergots. Before we proceed and we talk about ergot derivatives in detail, first of all, the first question that arises is, what is ergot? Ergot is a product of fungus, Claviceps purpurea, and this fungus grows on rye and other etc. grains. Now, either ergot derivatives, they are partial agonists or antagonists on serotonergic receptors or dopaminergic receptors or even adrenergic receptors. Examples of ergot derivatives, they are quite popular, like capital LSD, If we expand this form, it's gonna be D-lysergic acid diethylamide. It's a powerful psychedelic drug. Second, bromocriptine, which is a dopamine agonist. It controls the prolactin secretion. Third is methysergide, which is useful in migraine. And ergot, which is indicated in postpartum hemorrhage. These were used initially for migraine and all such kind of indications. Ergot derivatives are found to likely act on 5-HT1B, 1D receptors to be used in the treatment of migraine. They also stimulate 5-HT2A receptors to be used in the prophylaxis of migraine. But after all this, one really cannot neglect their harmful adverse drug reactions. Some notable ones are pleuropulmonary fibrosis, coronary fibrosis, endocardial fibrosis. And for the same reason, ergots, they are no longer prescribed, they are rather withdrawn from the market. That's all in this second part of migraine discussion. In the next episode, we're going to talk about more drugs which modulate serotonin or 5-HT signaling, and they are used for different indications. Till then, ciao, abianto. For all the updates and latest episodes of my podcast, do visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.